Good morning. This is Scott Mace, a Senior Technology Editor with Health Leaders. And this morning I'm here with William Smith. He's the CEO of MedRed, a technology company from the Washington, D.C. area. And we're here to talk about the CalConnect Workshop on May 21st in Reston, Virginia, where Dr. Smith will present the winning entry from last year's Veterans Administration scheduling contest, a team known as Healthy Time that put together a very impressive demonstration for the Veterans Department, and we will have a workshop that day. The workshop is free, open to the public. You need to go to the CalConnect website and register. There'll be some links along with some of the blog postings and comments for this YouTube video about how to do that. Good morning, Dr. Smith.
Good morning, Scott.
So tell me a little about your company and your interest in helping the VA improve calendaring and scheduling for their patients.
Sure. Well, first of all, I'm a rehab physician by training. I trained in amputee care specifically, and I had quite a long interaction with amputee care both in the United States but also internationally. When the war started, I got involved in some of the traumatic brain injury activities at Walter Reed, helping them to collect information and do research on traumatic brain injury, which, as you know, was one of the signature injuries of the recent wars. And then through that, I started a small company around that time to try to help with medical informatics, which has been, as you know, probably better than most, one of the huge technology themes over the last decade for this country as we move from, basically a paper-based system for medical records to hopefully more digitized and data-driven kinds of systems. And that process has been underway now through several administrations with a great deal of federal support. And so I had both an interest in the big issue of how you create electronic systems, but then also specifically an interest in wounded warriors and polytrauma care. So our company had done, as I say, work both on DoD side, and then we were selected as a winner of the first VA Industry Innovation Competition when they started that program a few years back in the polytrauma area for our data collection tools on TBI and other things. So from that, we got involved with VA. We did a pilot at the Richmond Polytrauma Center, and then we became aware of the scheduling issues. And as you know, there was a procurement a few years back, which didn't go well for VA. Over $140 to $160 million were spent before the program was terminated, and they didn't wind up with a solution, and that's created enormous issues for the veterans and those who served them over the years, and some of that's become recently very topical. But VA decided to do something very sort of courageous and unusual. They had a contest, and they asked industry to come in and provide their ideas about solutions, and they created quite a rigorous format in which to do that. And we were one of 41 entries in that competition, and we wound up finishing first, which was a terrific experience for us. And we hope that something will come out of that might help the VA as it moves forward, looking at how to replace its enterprise medical scheduling system.
And I know that in Virginia you're going to make a presentation about the contest, about your entry. You're also going to run through some video of some of the interesting features of your entry. Why don't you give our viewers here just a little bit of a taste of exactly what some of the innovative things that you put into that Healthy Time entry, what some of them were. Give us some examples.
Sure. I mean, scheduling is the VA has historically been kind of on the forefront of electronic medical records. They've been cited many times and won numerous awards for their record system of record, which is called VISTA. And over the years, VISTA has been has grown and been a very responsive system in terms of the users. They love it. But one of the oldest modules in Vista is the scheduling module, and it has some inherent difficulties. One of the difficulties is the fact that Vista itself is deployed as a series of installments across the country, and each of those installments provides local scheduling, but none of them currently talk to each other. Also, there is no way to correlate, because these are local instances, there's no real way to correlate timing for appointments across different time zones, and that becomes an issue for things like telemedicine and for scheduling remote visits, which are more and more part of practice today. So, part of what we wanted to do was to allow a system to interoperate between these various instances. Part of what we wanted to do was to create a system that would, kind of coordinate and work with different time zones. And then we also were interested in creating kind of a telemedicine capability so that you could, store information and coordinate appointments across various different, VAs. So those were some of the things that we worked on over the course of the scheduling competition.
And for those watching this who don't know anything about CalConnect, it turns out that yes, there is an industry effort to try to drive standards and interoperability throughout the calendaring and scheduling world, not just in healthcare, but in all industries. And I happen to actually serve as one of the members of the board of directors of CalConnect, in addition to the work I do covering healthcare for Health Leaders Media. So it's a really interesting convergence of my two passions, calendaring and scheduling and healthcare information technology, all coming together at kind of this summit meeting on the 21st in Reston. And not only will you be doing your presentation, there'll be a presentation by Osera, which is the open source group that helps promote adoption of Vista. One of the other entrants in the contest was actually a civilian hospital here in Oroville, California, which also uses Vista. It's not strictly used in the VA. And then following those presentations, there's to be a panel discussion, which I'm going to lead, in which we'll get into not only all of these issues, but some of the larger issues facing government and industry about how we can promote better interoperability of calendaring and scheduling. And for those who've never seen it, I have run a blog since 2005 called Calendar Swamp. You can go to calendarswamp.com and read 9 years of blog entries on my crusade to try and get industry and customers to vote with their dollars, to vote with their time and their effort, to really make some headway in what I think is a tremendously underutilized piece of technology, which is your average everyday calendar. What are your thoughts about how that discussion will go when we get to the discussion phase, Dr. Smith?
Well, it's a great. Thank you for making that point, Scott, because the piece I left off talking earlier about is really about the standards piece, and it's important because 60% of care for veterans is delivered outside the VA. So a lot of care that's active duty and veterans get is actually provided by other providers, and so it's very important that interaction between the VA and these other providers be facilitated through scheduling. Everything starts with scheduling. You start looking at things like wait time metrics, you start looking at care outcomes, you start looking at all kinds of things, and it ties back to scheduling. So we did want to provide some standard base for that and put an iCal server, which is a very simple kind of calendaring standard that really does permit the exchange of this kind of information. But to your point, there's so many other things that are emerging with HL7 Fire and other standards that are really important to incorporate into this kind of work, and that is a major piece of what I think VA wants to accomplish, because they're tied into the Office of the National Coordinator, and they're kind of should be implementing these standards, but also just from a functionality standpoint, it's so important to making sure that these things work in a way that's going to support the users. I'm excited about the conversation. I think it's incredibly topical. The the issues that we've had over the last couple of weeks, down in Phoenix, you obviously have to be really careful when you have a disgruntled employee about the kinds of things they'll say. But the VA is somewhat vulnerable to these kinds of things because the scheduling system, just the data model just doesn't support the full range of operations that the VA needs to take, to function. So people are winding up using things like Excel or other kinds of calendars in an ad hoc way to try to facilitate all this. And sometimes you can look at that and it's hard to make sense of, and that creates a vulnerability for the organization. So I think it's a very important and timely topic, and I'm really interested to hear the conversation out in Reston.
Yeah, it really boggles my mind that we're moving from a world where doctors' offices may still have a paper appointment book to this new world where, in demonstrations such as your own, we can implement advanced systems so that, say, a veteran has several appointments coming up and the first one has to be rescheduled. Now the system is intelligent enough to realize that the second or following appointments might have to be rescheduled and can do something about that rather than creating more headache and burden for some administrator or staff person somewhere.
Well, the VA itself has 60 million appointments a year. There's over 50,000 schedulers working on that. There's 25,000 providers and 2,500 points of care. So it is a massive undertaking to do all that, and to try to do it without any kinds of of data processing tools that we all take for granted in our lives is something that does need to be addressed, and I think will lead to a better experience and actually more accountability, because once you have a system like that in place, you begin to be able to track metrics more effectively, and you know that if you have a system of record that will handle scheduling and wait times and check-ins and check-outs and do all that kind of reporting, and it is the system of record and you don't have to rely on secondary systems, then Congress is going to get better data, then local VA administrators are going to get better data, and hopefully the veterans are going to have a less frustrating experience trying to set up appointments for the care that they need.
Well, I'm very excited about your appearance. I'm very excited about the fact that CalConnect, a group that meets all over the world twice a year, has chosen this next meeting. There'll be a whole week of meetings in Virginia. This workshop is but one part of that. The other parts are open to members, but if you visit calconnect.org, anybody who's watching this, you can find out more about how to join CalConnect and attend the whole week. It's going to be a very interesting week with lots of interesting standards development going on there. I should mention my colleagues Gary Schwartz and Executive Director Dave Toulis. They are more than happy to answer anybody's questions about what CalConnect does and about all the activities that will be going on that week in Virginia. Again, the date of the workshop is May 21st. It will be in the afternoon. It is free, but there must be registration. So if you go to the CalConnect website, there's a page where you can go to register for the workshop, absolutely free. And I hope that anybody who's interested in this topic can join us there. And meanwhile, Dr. Smith, I hope that you have found this chat interesting. I have, and I think it'll be a very interesting inflection point in some very important work to try and make some real progress on this.
Scott, thanks for your time and for your interest and for all the work you do.
Thank you. Everyone have a great day.